Currently, they are not, but and recently we will share them with the community. We have already shared. We are still working with the data in order to publish them in magazines. But yes, hopefully we will have them available to everybody. Clarify.
This work is part of a bigger group of investigations, researchers that are being conducted in hot springs, geologically, hydrogeologically, and ecologically as well. So we are, this is a small portion of the whole research that we are conducting through the help of the Universidad Autónoma de Tamaulipas. Thank you.
Thank you. Thank you.
So just to end with this presentation, we want to extend our gratitude to our speaker. So we want to express thank you very much for your presentation. So we extend this congratulations and a small gift. To continue with our program, we want to invite Carlos Hernandez Nava to present the work entitled Spatiotemporal Analysis of Diabetes-Related Hospitalizations, Geographical Areas of Mexico.
Good morning. Hello, everybody. It's a pleasure to be here. I'm going to talk about spatiotemporal analysis of diabetes-related hospitalization, geographical areas of Mexico. Please. My name is Carlos Hernandez. There are a lot of data generated, digital data nowadays. 328 million terabytes every day of digital data in the world. And a lot of these data are electronic health records. All the health system are now in a digital world. So electronic health records are in many countries, and these records has the location, the residence of the patient, of the population. These records has this feature that they now has the location, the latitude and longitude, maybe direction, the address. Thank you. Particularly when we go to the physician, or we have the different levels of care. The primary level is the doctors we have in near to our houses, and there are some potentially avoidable hospitalization. Will represent hospitalization related to ambulatory care sensitive condition. So this is a kind of disease or condition that can be avoidable if we treat them timely and effective manner in the first visit to the physician. If this contact with the physician is effectively and timely, you can avoid to reach to the hospital. This is avoidable hospitalization. And diabetes mellitus is in a condition that you can treat with this condition. There are to measure how primary care level of health system is preventing or treating this disease. there are some indicators by the Agency for Healthcare Research and Quality, and this is the indicator, preventive quality indicator, and admission by diabetes short-term complication, diabetes long-term, uncontrolled diabetes, and lower extremity amputation among patients with diabetes. These are all admission in the hospital, and as an urgency manner, reach the hospital when they have this condition. So this is an indicator that many countries over the world is working to measure the quality of prevention of this disease in particular. Here in Mexico, there are a lot of records, open data about health records, and Secretaría de Salud and Dirección General de Información de Salud in Mexico has one website with all these records every year, maybe 2 months, each 2 months, update the data. And another data that we use is from INEGI, Instituto Nacional de Estadística y Geografía, and all the records that we work is more 36 million of records through these years. Of hospitalization, we divide the country of Mexico in 8 geographic areas: Pacífico Norte, Pacífico Centro, Centro Norte, Pacífico Sur, Península, Mexico City and State of Mexico, Centro y Frontera. All these are the geographic areas that we divide. The methodology we follow is data collection, cleansing, processing, underlayer analysis, outlier analysis, model interpretation, and presentation. This is the methodology we follow. And as a result, I only present one table, but we have this table for all the geographic areas. This is the adjusted rate. We have to apply a design study from epidemiology field. And in Peninsula, this geographic area, the southeast of Mexico, has the highest adjusted rates for women and men. In this case, for women, in 2012, we have that 144 persons reached to the hospital because of some complication of that diabetes, and this hospitalization could be avoidable. This is an important thing because it's comparing to the organization, or members of the Organization for Economics and Cooperation Development, the OCDE, comparing with the other countries of this organization, is the double. It is value double the average of hospitalization, avoidable hospitalization because of diabetes. And this is a risk. But from the other side, Frontera, all the states or the cities near to the boundary to the USA has the lowest adjusted rates. So, over the years, please could you click? We can see in this animation for men and for women, the darkest is a higher rate of avoidable hospitalization. We can see the southeast of Mexico has the higher level or values of hospitalization over the years. This is the avoidable hospitalization adjusted rate. For all these graphics, we have to apply epidemiologists and biostatistician methods to get these rates. And we can see that Peninsula, how is all these geographic areas are in the same pattern, but Peninsula is very different. And we can see the pandemic period, the pandemic of COVID. We can see all the areas, all the rates goes down and become to stabilize again in these years. So these are the values. Resource limitation data set is only for Ministry of Health units, hospital that belongs to the Ministry of Health of Mexico. No, doesn't include IMSS or ISSSTE. We have to collaborate with another disciplines. In this case, epidemiologist field. We have to talk, to collaborate with an epidemiologist to validate the data. Conclusion: primary care level could improve diabetes treatment in early symptoms. Provide data and information for those who make decisions and formulate public health policies. This is an important thing. This there doesn't exist, although these data are open. It doesn't exist a systematic system to get these results. Only if you want to analyze, if you want to do some kind of studies, but that doesn't exist something or this kind of studies systematic. Spatiotemporal describe trends of diabetes-related hospitalization. It's very useful to analyze using and dividing the country and geographic areas. We can maybe apply some particular studies in the peninsula geographic area that is the highest rate. So there are more things to do. Maybe take another variables like education, living, food, access food to apply, and this is another study. This is the future work to do to add some variables in the question. And that's all for me. If you have questions.
So remember that participating with one of your questions will give you a small gift in form of a small pen. So if there are no questions for our speaker, we will finish this presentation by congratulating, excuse me.
Yes. 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 Talking about the data, how exist some constraints to manage the health data in Mexico. These are on open data in Mexico, but doesn't contain confidential information like names or IDs. This doesn't exist in these records. Maybe here in these records, one person reached to the hospital, 2 or 3, but I don't have in the records. I don't have we can identify if one person reached 2 or 3 or more times to the hospital, but because of the same complication of diabetes. This is a constraint in our data. They're sensible if we have the identification of how to confidential information, but doesn't have. Maybe the most is the residence, is the column of the variable we have in the data, but it doesn't identify for any person in the data. Yes, thank you.
Well, we will finish with this excellent conference by congratulating our speaker with a small gift. So now, in order to solve some technical problems, we will give a small coffee break of just 5 minutes. You can go to the outside of this building for coffee, and we will come back. We'll continue. Excuse us. We will continue with our next conference, so we invite Christophe Clarmont to attend to this podium. So, for our next presentation, we have the pleasure to receive Professor Christophe Clarmont. Professor Christophe Clarmont is a professor of computer science at the Arts et Métiers Institute of Technology and Naval Academy Research Institute. He is one of the deputy directors of the East Blue Interdisciplinary Graduate School for the Blue Planet, and he is involved in marine science, marine technology, and ocean innovation. He was a senior lecturer in computing at the Nottingham Trent University and a senior scientist in GIS at the Swiss Federal Institute of Technology. His research is oriented towards theoretical and pluridisciplinary aspects of geographical information science. Please